Zoom live feed. Good morning and happy Friday, Biba Betness on all of you.
Good morning, half a day.
Good morning.
Good morning.
Good morning. We wanted to bring.
Sorry, Melissa had to leave. She's going to work.
Right.
Okay.
Yeah. Thank you.
It's the
Thank
three
you.
of us.
Sorry for the delay. It's just with all the COVID-19 protocols and the social distancing and everything. Just really slows things up here on the link. So,
Okay.
good morning. Let's jump
No
right into it.
problem.
You guys are having a conference coming up, and we wanted to get the word out here because we know that the people with diabetes and other chronic and pre-existing comorbidities are likely to be hit the hardest by the coronavirus. So, anything we got to do to help with diabetes, we're so there. So, tell us a little bit about this virtual conference that's coming up.
Yes, I'm going to talk about the virtual conference. You know that every November, the Guam Diabetes Association holds or sponsors the diabetes conference during this month. But due to the pandemic, some of the officers thought of just like removing it or not doing it. But we said we want to continue the tradition. So we thought about the virtual. And so the Guam Diabetes Association with GDCC and with Mountain Pacific Quality Health. Again, I work for Mountain Pacific Quality Health. So we're able to coordinate and put up this virtual conference, which is going to be held on November 14 from 9 a.m. to 11 a.m. And our theme is managing diabetes through the pandemic. So we're going to have three presenters. Of course, Dr. Keith Corinucci is one of our presenter, and he will be talking about inflammation, diabetes, and COVID-19. Another speaker is Dr. Ann Pubutsky, our Guam territorial epidemiologist. Her topic will be diabetes and obesity as factors for COVID-19 infection, because I think they have determined that more than 50% of those who turned or diagnosed positive have chronic diseases, most specifically diabetes, obesity, and hypertension. And our third speaker is supposed to be Chris Kylin, a diabetes educator from Miles City, Montana, but we just got a email from her that she is unable to do it due to family emergency. So Aggie and I, the committee, will look for another presenter. But we're really looking forward for the people of Guam to participate. So this is open for everyone. They need to register. It will be via Zoom. I think we have sent out the registration link to a lot of social media platforms. And but we're not giving continuing education at this time. Our nurses and some healthcare providers, they used to get CEs in the past, but not this year. So maybe next year when we can be on a face-to-face conference again. So yeah, I would like to, I forgot to mention that this is in partnership with, of course, Guam Diabetes Control Coalition, the Department of Public Health Social Services, the Diabetes Prevention and Control Program, and Mountain Pacific Quality Health. So we're inviting everyone. So far, I think we have over 50 people who have registered, and anybody, even outside of Guam, can participate in this virtual diabetes conference.
Why do you think it is that you said that half of the people that have contracted COVID have chronic illnesses and more particularly diabetes? Why do you think that is?
Maybe Dr. Keith can answer that.
Good morning, Doc.
Good morning. Good to be on your Zoom. Yeah, of course, I've been on Guam for quite a while now, and have treated a lot of diabetics over the years. And unfortunately, on Guam, a lot of the diabetics don't have really good control of their blood sugars. And we know that when their diabetes is uncontrolled, there's a couple of factors which I'm going to be talking about in the conference. Is one, high blood sugars will decrease your immunity. So that's one of the predisposing factors why diabetics who are uncontrolled may be more susceptible to complications with the virus. The second issue is inflammation is also increased with diabetics who are uncontrolled. Other comorbidities include obesity, hypertension, and a lot of the diabetics have all of those together. And so it just compounds the problem. And so I'm going to be talking about, natural things, diet, lifestyle, things that we can do to control some of this inflammation, boosting the immune system. And of course, ultimately, we need to have the diabetics with much better blood sugar control. But even beyond the diabetics, all of us should be trying to improve our lifestyles.
Right. Doc, I hear a lot of times with, maybe not even just diabetics, but people who are thinking, oh, tomorrow I'll stop eating rice, or tomorrow I'll cut out my midnight snacking on Snickers bars. No names.
Yeah, the last few months, I'm calling it the COVID weight gain everybody's going through, And so as we're gaining weight, that's also probably increasing our risk factors too.
Are you finding that a lot of diabetics and other patients with maybe chronic illnesses, and we can just run through, and you can all take a shot at answering this, are they not going to the clinics just to get their regular maintenance, to get their checkups? Because that's what we've been hearing, throughout the pandemic since March, is that, they're not going to get the checkups, and then maybe a lot of them are catching COVID and showing up at the hospital when, they're already at death's door.
Yeah, of course, I cannot speak for all the other doctors, but even just in my practice, which is, in natural medicine, nutrition, patients are hesitant to come in because, they just don't want to go out, and they're quite afraid of just exposing themselves. So only those that feel more comfortable, or those that feel a little bit more secure. So I think that's also happening with all the other doctors around the island.
Agnes?
If there's the opportunity for telehealth for those who are reluctant to actually physically go to the clinic. And I'm not too sure how many people are availing of this opportunity. And I know some insurance companies are covering it. At least Center for Medicare and Medicaid Services, it's covered for those who have Medicare. So, telehealth is another way that they can connect with their provider. And that's what the coalition is trying to do, trying to let people know that you need to connect with your provider to help, bring your blood sugars under control. Ann Pobutsky, the territorial epidemiologist, will give one of the talks, and she informed us that over half of those who have died from COVID-19 had comorbidity of diabetes. So that's really alarming for us. And as the coalition, we were just brainstorming ways to reach these people. Perhaps this conference might do it. We also have PSAs going out that we developed that we'll try to put in the media really consistently with the phone number that they can call. It would be the GRMC Patient Education Department. They so willingly agreed to have their number put out as a contact for people who want more information, who need more help, who need just some guidance. So we're very grateful for them for doing that. Mm-hmm. And I just want to put it out there that people, you need to control your blood sugars, your blood pressures, and you can do it. Connect with your provider, connect with people. And unfortunately, the way we do things on this island, it's more personal, one-on-one type of thing, but under these circumstances, we cannot. And unfortunately, we have to rely on technology. If you told me last year that I'd be trying to hold classes online and doing lots of things online, say you've got to be kidding. But we all needed to learn real fast how to do some of these things. And it's a learning curve. And I myself, I'm still trying to get used to all this kind of stuff and teaching online. It's very difficult for me because I'm a very hands-on person and have lots of models in some of my classes and lots of hands-on activities. And now I have to do it on screen. But we got to make the most of what we have at this time in our life. So I just encourage those with diabetes, it's possible you can live well with diabetes. It's just uncontrolled diabetes that we have to get a hold of and address. And so please contact people. There's people out here in the community that are more than willing to help. So it's just a word of hope. Not everything is gloom and doom, because things can be controlled, and there's ways you can learn how to do this, very practical ways.
One thing I think we should encourage is home monitoring. A lot of people don't check their blood sugars at home, but that's at least one way that they can know if they're controlled or not controlled. Just in the last couple of days, I had a couple of patients with blood sugars at my clinic over 400 and totally unaware of it. They don't feel bad. Usually if your sugars are that high, you're going to feel something, but a lot of people are very resistant to any kind of symptoms. They feel normal, so they need to check. And if you're at home, we need to get people to use their machines.
And if I may add, Sabrina, we're not only talking about the people with diabetes, but there are a lot of people that have pre-diabetes and they don't know that their sugars are going up already. Like what Dr. Keith said, some people they don't know that they have diabetes or the pre-diabetes. They don't have signs and symptoms, but if they know they are at risk, then they should be checking up with their providers. So at risk, meaning if they have family history, they're obese, they have hypertension, then they probably will have to check with their providers. And that's the other problem that we have is some people, or most people, they don't have primary providers. So we have another group within the GDCC is our Patient Family Advisory Council that we started also to create flyers to inform the people how to get primary provider. What is a primary provider? So we're working on that. But again, it's very important to reach out to your providers. And if you don't, then we can help with our flyer that we'll send out. Thank you.
So, Doc, you said you guys were mentioning how some people don't know that they might have diabetes. So what kind of signs and symptoms should we look out for?
Yeah.
Well, the things to look out for is sometimes just feeling sleepy after having a large meal. You know, that's dysregulation of the blood sugar and a rise in insulin. And just people that are overweight may have an elevation of insulin, and that's one of the things that causes inflammation. So it's not only the diabetics that are at high risk for inflammation, it's just people with prediabetes that produce excess insulin. So after a meal, you can feel sleepy. Of course, weight gain is probably another indicator that your body is producing more insulin and it's just converting it and storing it as fat. That's why we can gain weight so quickly. You know, that's why just having a quick blood sugar finger prick is very helpful. And so even a random one, any blood sugar over 120 might indicate that there's some insulin or prediabetes. Over 100, over 200 random could be diabetes. Fasting blood sugar over 126 is diabetes. But like we're saying, it's not only just those that are diabetic. a lot of people that are pre-diabetic, have insulin resistance. They're going to have possible risk factors for inflammation and decreased immunity.
Doc, I want to
Also,
go ahead.
I just want to add to this pre-diabetes symptoms. Sometimes, it's pre-diabetes. You don't know you have it. And in the past, your doctor might have said you have borderline. And then I find if people think that they have borderline, they're still okay. But it's not. You're not okay. It's called pre-diabetes, and something needs to be done about it as soon as you can do something about it. Some of the risk factors Glynis mentioned, perhaps you aren't actually diagnosed with pre-diabetes, but some of the risk factors you might have, like she mentioned, overweight, you could have high blood pressure, your cholesterol might be elevated, you have a family history, just the fact that we're Pacific Islanders, Asian and Pacific Islanders, that's also a risk factor. Our age, over 40, you're also at risk. But however, as a diabetes educator, I'm finding that on Guam, I'm seeing 20-year-olds already diagnosed with diabetes, and actually even younger.
Yeah.
So maybe age, not so much an island. I just think that many of us here on this island have a lot of risk factors. So we should be checked for diabetes, which means that we have to connect with a primary care provider. We need to get our blood work checked. And that's very, very important. One of the symptoms, you asked about some of the symptoms. Sometimes people just have lack of energy. Might not be totally wiped out and totally fatigued, but just a simple lack of energy that you've never had before. I would definitely suspect something like pre-diabetes in that case.
I know you guys normally do a lot of outreaches where, typically with a conference like this, you might be, center court, micro mall with your finger prickers and all your, pamphlets. And because I've walked into a few of these different events, I've hosted a couple in the past. How challenging is it to not be able to get that face-to-face interaction with the populations that you need to get it with? And we'll start with Glynis. Go ahead.
Yeah, it's really very, very challenging and frustrating not to be able to go out there in the community to do those things that we used to do for so many years. And some people even ask us, other companies, or we even go to the big stores to do these outreaches, blood sugar, blood pressure screening, but and during the conferences. So hopefully by next year, early next year, we'll be able to resume that activities again. But for now, we just need to let the people know that they have to go to their doctors. If they have the equipment to use to check their blood pressures, the glucometers to check their sugars, then they have to do it. They have to do it religiously.
Can we switch gears just a little here? I wanted to talk about, because we kind of opened with how susceptible diabetics and those with chronic illnesses are to COVID-19 when they get it. Obviously, a lot of them don't fare very well. So I just wanted to ask Doc, because we value the perspective of all the medical professionals that come on the show. But what's your take on where we are with coronavirus right now and the rampant, widespread community transmission, the deaths, the hospitalizations? Just maybe your 2 cents. If you want to give us $1 on it, we'll take it.
Yeah, I'm not even sure if I have a penny for that. That's the big question. Are we seeing more numbers of infections because we're doing more testing? Are we not being careful about the masks and the social distancing? I think Guam people in general are very compliant, compared to around the world. And yet, we see our numbers going up. But yet at the same time, I haven't done any compare of the data, but since Guam is so small, our numbers are, of course, quite small too. And is it because we are being a little bit more diligent than other states? I think it really just ends up with the fact that, we just need to be healthy. I think the future is all about how healthy you are, so that whatever viruses are coming up, because there's going to be more in the future probably, are you healthy enough to withstand these viruses? Is your immune system strong enough? But for decades now, American people have been in poor health. We're not a very healthy population compared to other populations in the world. Some other countries are doing really well with this virus. So I think the future is, we just need to keep pushing and educating about exercising, eating well, eating healthy foods, and of course, I say take supplements too, because it's the food may not always be adequate.
Right.
So I don't have too many pennies there,
Just the basics, right? Yeah.
Are any members of the GDCC, the coalition, a part of the physicians advisory group, or involved with
No.
any of the discussions with the COVID
No.
response?
No.
Not at all.
Don't you think you should be though?
If half of the cases are
We
think
have
should
some
be-
doctors who are who attend our meeting, like Dr. Blounce from GMS. And we did have Dr. Akuma one time, Dr. Taitano, John Taitano. But yeah, rarely.
Yeah.
do you feel you
So,
should
I mean,
be?
I think I just want to add something to what Dr. Keith was saying about being healthy. Our population here on Guam, we are probably one of the unhealthiest people around. When a third of our adults smoke, well, that has reduced somewhat. Right now, it's down to how much? A high 20% of 28. I don't know, but anyway, many people smoke. The overweight rates are high. So, just to begin with, our population was unhealthy. So it shouldn't be such a big shock that so much of these things are happening to us. So the emphasis on prevention, on getting healthy, that message has to go out. People have to realize that, yes, we do need to wear a mask and socially distance, but we need to get ourselves healthy, like what Dr. Keith said, so we can have an immune system that's able to fight whatever viruses come along. And, the coronavirus isn't going to be the first one. So I just encourage people, if you smoke, you need to stop now. If you need to lose weight, we need to do it now. And yes, it involves hard work. Lifestyle change is always hard. But if there's ever a time to do it and to make the changes, it's now.
Yeah.
And it's never too late. You'll find some metabolic advantages just by simply losing weight. Your body will, you'll make yourself, your body will be very, very happy.
Yeah, you're gonna
Once
feel
you
good.
start down the road.
You're gonna feel good. Yeah.
Yes, exactly.
Well, thank you guys for
Yeah.
coming on. And real quickly, where do you go to register?
Chris, I sent you the
Right. Yeah, we got all the. We'll
link
pop them up. We'll pop them up.
and the flyer.
Yeah, yeah.
Yes, so we'll be sending that out to the different, our Facebook. And you can call Winnie Butler, who is the Executive Director of Guam Diabetes Association, 632-1971. Or you can call me, 787-4148 for more information.
And Doc,
Thank you for having us.
thank you, ladies. Doc, I want to touch base. Maybe if you could shoot me your number, I'd like to get you on to talk about some other stuff. I had a couple of friends who went to your clinic and got the full workup. They were looking for mercury, a high fish diet, and just other heavy metals and contaminants. Because I know you do that kind of blood work over there. So maybe we can bring you on in the next couple of weeks to kind of talk about that, because I think that was really interesting.
Sure.
Okay, Doc. Appreciate it.
Stay safe.
Thank you, ladies. Thank
All
you.
right.
Thank
Thank
you.
you.
That's,
Thank you, Chris.
Jay,
Thank
what
you,
do we got in
Sabrina.
here? We have brown rice,
Oh, yeah.
virtual brown rice.
Brown rice, salmon,
Where's your
Remember portion
vegetables?
control.
Yeah.
Only a third of a cup, okay? Only a third of a cup of brown rice. It's
Yeah.
good, but it still will raise your blood sugar.
Thank you, because
Portion
my
control,
relatives
folks.
think if it's brown rice, they can eat triple the amount because it's brown. Then I got some relatives who think brown rice is just when you put finadeni on white rice.
Right.
Not right. Yeah, Doc's like, yeah, I heard that before. Okay, thank you guys. So just take our
Bye.
virtual. We have some virtual
Okay,
Benefiber there
bye-bye.
too. Thank you. Bye.
Okay, thank you very much.
Hasta.
Take care.
Adios. It's 8 o'clock. We're KUAM FM in Agotni, Guam. Good work managing diabetes through the pandemic. It's crucial stuff.
We're going to post that link
Yeah.
so that you guys can take advantage of this.
And to our viewers on KUAM TV, thanks for jamming with us on this November 6th edition of The Link. And we do have the invite for the Virtual Diabetes Conference up on our Facebook Live feed. It's 8:01. We're KUAM FM in Agotni, Guam. There's a whole bunch of great programming coming your way on KUAM TV, but you can also jump over here on the radio. Again, The Breeze 93.9. We've also got an audio stream, Docomo Channel 10, on our Facebook Live.